Obviously, one of the key questions that comes up in the treatment of breast cancer is what are the indications for chemotherapy, either preoperatively, known as neoadjuvant chemotherapy, or postoperatively, known as adjuvant chemotherapy. This is a very large topic and could take an hour to answer, but let me try to give a few general statements. One thing that I see fairly often is that women sometimes confuse ductal carcinoma in situ, or DCIS, with invasive breast cancer. DCIS has no potential to spread and therefore never needs chemotherapy. The indications for chemotherapy in invasive cancer are to look at the various characteristics of the cancer and look at the potential benefit of the chemotherapy versus obviously the risks and toxicity of that chemotherapy. The major factors that we look at are the patient's age. The older the patient, in general, the less effective the chemotherapy. The size of the tumor. Obviously, larger tumors have a poorer prognosis and may need chemotherapy. Probably the most important factor is the status of the lymph nodes. In general, we would give chemotherapy pretty much to everybody that had positive lymph nodes, especially if they were younger. And then there are tests that we get on all breast cancers: estrogen receptors, progesterone receptors, and a gene called the HER2/neu gene. These also all have prognostic significance and help the oncologist decide the appropriateness of chemotherapy. Hormone receptor positive tumors in general have less response to chemotherapy, whereas in hormone receptor negative tumors, especially in young women over a centimeter, would almost always get chemotherapy. In HER2 positive tumors, which are inherently more aggressive, in tumors over 5 to 10 millimeters, in general, we would give a chemotherapy with the drug called Herceptin, which has revolutionized the treatment of HER2 positive breast cancer. So there are any number of factors that go into this. Some of the newer techniques that we're looking at are genetic factors. This would be like the Oncotype test that looks at hormone receptor positive, lymph node negative breast cancer, and is a 21 gene test that gives us a sense of the patient's risk of distant recurrence, and equally importantly, whether chemotherapy would change that risk of recurrence. So in the hormone receptor positive, lymph node negative patient, which is the most common group of breast cancer, one should consider doing an Oncotype test. So there are any number of factors that go into this, and one would need to discuss all of these factors with the oncologist, and the patient and the oncologist come to a general consensus as to whether the benefits of chemotherapy in her particular situation outweigh the toxicity and the risks.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment.
and the genomic test.
A test that helps guide a woman and her doctor
To the best treatment options for her.
Pass it on.